Let me pull that up here.
Okay, we're live already, by the way, just in case you haven't. I'm going to mute my mic.
Wait. Hi, Judy. You can still hear me?
Yes, ma'am. And I see your
Okay.
beautiful face also.
Oh, okay. All right. It's 7 a.m. So I guess we'll get started. People might be jumping in at any point. Yeah. So greetings and namaste, everyone. Thank you for joining us today. My name is Kusum Hachetu, and I'm your host for today's webinar. We've organized this webinar to help you with the healing process after the devastating earthquakes in Nepal, the deadliest disaster in Nepal's recent history. Today's webinar will explore ways to manage our mental stress and also help others cope with the current situation. Before I hand it over to Judy, I'll just briefly go over some technical and logistical details. We have Yosin Shrestha, and he will be helping us with some of that. So we have an hour for today's presentation, and Judy will present for the first 40 minutes, and then we'll have 20 minutes at the end for questions. But feel free to post your questions on the comment section below. If you have any comments during the presentation, feel free to post it there. And we'll try to cover as many questions as we can. So yeah, that's all I have to say. Without any further delay, I will now pass it on to Judy.
Good morning, namaste, everybody. I'll just give a brief introduction to myself and to the presentation. My name is Judy Greenberg. I'm here in Washington, D.C., and I'm a licensed psychologist. For the last 15 years, I've been specializing in psychological trauma and self-care for people who are impacted by trauma. So that's pretty much what I'll be talking to you about today, is what is trauma, how does it affect you, your brain, your body, your heart, and also what are some strategies that can help you get through this hard time, but also for those of you who are helping and supporting others, you can use these very same strategies that I'm teaching you with anybody you work with. So I'm really, I just use very clear, understandable language. I hope it's clear and understandable so that you can then take these skills and teach them to whoever you're working with who also needs support and care. It's a little strange to have it be a one-way conversation. I usually like to have a back and forth, but because of the technology and the numbers of people, we can't do this till the very end. So what I'd like to do is also remind you that trauma, that this presentation, I may ask you to think of things or try things, and your job is always to take care of yourself first. So if I ask you to think of something or to try an exercise and you're not comfortable with it, or you feel like it's not going to be a good idea for you for whatever reason, I encourage you to first always take care of yourself and think about what's best for you. So please, you be the boss of that, and that's the first rule of trauma, is always taking good care of yourself and you being the one to decide what's best for you. Okay, so let's start with a little exercise before I get into discussing what trauma is. Okay? This is deep breathing I'm going to teach you. We're going to do it for maybe 3 or 4 minutes, and I encourage you to give it a try. The reason I like to teach deep breathing when I talk about trauma is because trauma always reprograms our central nervous system. Our central nervous system is the same central nervous system that we have from 200,000 years ago when we were cave people, and the danger in our world was a saber-toothed tiger. So we learned fight, flight, or freeze. Those are the 3 responses that our central nervous system knows about, goes on automatic pilot. And so it's as if our central nervous system, by being around trauma or hearing stories of trauma, it's the same thing. It impacts our central nervous system, our bodies, so that we're kind of get programmed to hyperarousal, hypervigilance, that feeling that you're always looking around for danger, even when you're trying to rest, you're lying down to go to sleep, or if you fall asleep and wake up in the middle of the night, you find your heart is racing, your palms might be sweaty. And so this is a lovely way to calm our central nervous system down. It works all around the world. It doesn't matter what language you speak or what country you live in, because our bodies are all the same. And it works in just a few minutes. So this is something I'm going to teach you. We'll start with this, and this is something you can teach to everybody you're working with. So to start with, get in a nice, comfortable sitting position. Put your hands on your lower belly, because we're going to do belly breathing, not breathing from up here. When we breathe from our chest, that makes us more anxious and leads to more panic. So when we breathe through our belly, it's very calming, and it brings the stress level down back to a normal place, whatever is normal for each person. So put your hands on your lower belly, and just pay attention when you breathe in that your belly expands with the air, and when you breathe out, your belly contracts. So you have your hands on your belly, and you can feel it going in and out with your breath. And I'm going to just count. 4 counts for an inhale, 4 counts to hold it, and 4 counts to exhale. If this counting confuses you, just do it on your own, as long as you're doing it nice and slowly and not rushing yourself. Okay, so if you're comfortable, please close your eyes. Just gently let them close and listen to my voice. We'll just do this, like I said, for a few minutes. So everybody, with your hands on your belly, take a nice deep breath in, 2, 3, 4, and hold, 2, 3, 4, and breathe out, 2, 3, 4, and breathe in, 2, 3, 4, and hold, 2, 3, 4, and breathe out, 2, 3, 4. Breathe in, 2, 3, 4. Hold, 2, 3, 4. Release, 2, 3, 4. Breathe in, 2, 3, 4. Hold, 2, 3, 4, and release, 2, 3, 4. Now this time when I ask you to hold, I want you to let your awareness just gently float from the tip of your head all through your body, through your torso, your shoulders, your stomach, the tops of your legs, all the way down your legs, and just notice any place in your body where you feel tension or tightness or any bad feeling at all, and just let those bad feelings come out and release with your exhale. So take a nice deep breath in, 2, 3, 4. Hold it. 2, 3, 4, and release any tight feelings. 2, 3, 4. Breathe in. 2, 3, 4. Hold. 2, 3, 4, and release any bad feelings. 2, 3, 4. Breathe in. 2, 3, 4. Hold. 2, 3, 4. And breathe out any bad feelings. 2, 3, 4. And last time, breathe in. 2, 3, 4. Hold. 2, 3, 4. And release. 2, 3, 4. And then gently open your eyes and return your awareness to being on your computer screen on this webinar. Come back to the present moment. Now, normally, again, if we were in a conversation, I would ask how many people feel worse after doing that. Hopefully nobody. I would ask how many people feel about the same. Usually 1 or 2 feel about the same. And how many people feel better. And most people report that they feel better. So again, trauma impacts all parts of us, and you can approach it through the nervous system, calm people's bodies down, and then our brains can work better. Once our body is calm, our brains become calm as well. So it's a very nice feedback loop between our body and our brain, but we start with calming down our bodies. So again, I encourage everyone to practice this, maybe first thing in the morning when you wake up before you go out to do whatever work you're going to do, or in the evening before you go to sleep. It's very calming and it helps your body get ready for sleep. Also, again, you can teach this to anybody you're working with. Okay, so let's talk now about what is trauma. And the way I like to explain it is exactly what we know from the latest neuroscience, which there's all kinds of great new developments in trauma and neuroscience going on all the time. Now, if we assume that our brain's main job, its main function is to process information. So when you do something just normal, let's say you walk down the street to visit a neighbor, and then you have a nice visit, you have a cup of tea, you go back home, nothing unusual happens. Your brain will process that information and store it in long-term memory. I like to think of it as taking a nap in long-term memory, which means it's still there, and you can recall that information if you try to. You can remember it if you want to, but it's not jumping up and coming into your face all the time. It's just taking a nice nap in long-term memory. So that's what happens with normal events. A traumatic event, on the other hand, is something that's so big, you can't see my hands, but they're wide open, so big, that it overwhelms our brain's ability to process information. Now, each person's brain is unique, so what's traumatic for one person may not be traumatic for someone else. It's not a competitive sport. It's not like you're a good person if this doesn't get processed as a traumatic event and you're a good person if it does. Everyone's brain is different. So if an event overwhelms your individual's ability to process information, your brain won't be able to store it in long-term memory. So this traumatic event is so big and so horrible, our brain basically says, this is so big, I don't know what to do with it. I can't process it, it's too big. So it puts it over here to the side, and it builds a nice wall in our brain between that event and the rest of our brain. And that gives us immediate relief from thinking about that event all the time. So we go, phew, that's over there, I'm over here, I'm safe, phew, okay? Now, it does, in fact, work. It does give us immediate relief, but there are certain problems with this system. What are some of the problems with this? And again, this is something that our brain does automatically. We don't have any control over it. Okay, one of the things that happens with this is that we've built this wall between that event and the rest of our brain to protect us from how horrible that event is. So this stuff kind of sits there in a pile, right? It doesn't get processed through our brain and get to sleep in long-term memory. It just sits there in a pile. And some of the characteristics of stuff memories that are behind this wall in a pile are that they're frozen in time. So for example, you can ask someone, if you were talking to someone who had, let's say, been raped 30 years ago, if she hadn't processed that information, you could say, I want you to think about that event, and the response would be, I can remember it like it was yesterday. It's as clear as if it just happened yesterday. So that stuff behind the wall gets frozen in time. Again, it just sits there frozen. It doesn't get a chance to process through our brain and go to long-term memory. The other characteristic of stuff behind the wall is that because it doesn't get a chance to process through our brain and mix with everything else we know, that it doesn't get integrated. Okay, we can't really make sense of it with all the stuff we know in our brain. So again, if you talk to someone, let's say, who had been a victim of sexual assault a long time ago, she might say, I know in my heart that it wasn't my fault, but I can't help but think that somehow I caused it, or that I'm dirty, or that I'm a shameful person. So the parts of our thinking and feeling don't get to integrate, again, to process that information. Some characteristics that impact how trauma affects us: if you've had a history of trauma, in other words, if you've lived through several traumatic events without processing it, then you have a lot of stuff piled behind your wall. So it's more likely that when the next terrible thing happens, it's going to get put behind the wall and not processed through our brain. Now, what do I mean when I say process through our brain? A lot of times we do this automatically, right? When you think of if you have a bad experience, but it's not overwhelming, let's say a loved one dies of old age, it's still a sad experience. And the way we process those kind of normal bad experiences is maybe we talk about it, right? We talk about it with our family, with our friends. Maybe we write in our journal about it. Maybe we dream about that person. Maybe we make ceremonies or celebrations to honor that person's life. So we do all kinds of things that help us tell the stories and get that information processed through our brain, so that over time, the part that hurts gets less and less and less, right? And we make sense of it in some way. Hopefully, we get to take some piece of that event and we get stronger from it. It nourishes us or nurtures us in some way. So again, when it's a traumatic event, because it overwhelms our brain's ability to do all that processing, we don't get to do all those steps. It also, of course, trauma impacts us on many, many levels, not just our brain, but hyperarousal. We get that hypervigilance. The hyperarousal is that kind of jumpiness where you feel like any little noise, or in Nepal, maybe a truck driving down the road that shakes the road a little bit, may make you feel really jumpy and scared, right? Because it will cause a reminder to you of that stuff that's piled behind the wall. So any reminder out in the world that is thematically related to that stuff behind the wall causes that stuff behind the wall to kind of wake up like a sleeping dragon and say, whoa, how about me? Now do I have a chance to get processed through your brain? And then all that stuff gets woken up, and it's all of a sudden this little reminder becomes overwhelming to us and too much again. So for example, that's why maybe if a heavy truck, a construction vehicle, loaded down with heavy things, shakes the ground a little bit as it passes, and all of a sudden you're in a panic mode. We call those reminders, you already know this, I'm sure, we call those reminders triggers. So that's another characteristic of this stuff that's piled behind the wall, is that it's available for anything to trigger it off. And that overwhelms us all over again. So again, a little event like a truck driving down the road all of a sudden becomes overwhelming. So it becomes more another reminder of that trauma, another reminder of that stuff piled behind the wall. So that again affects our nervous system, causes that hyper jumpiness and the hypervigilance, which is the always looking around to see where danger may come next. So, so in terms of the way to help with processing trauma is that we try and break it down into little bite-sized pieces, right, to process it. So you take a little piece of it and try and chew it up, digest it, put it through our system so that it can eventually get put into long-term memory and take a nap. Once things are in long-term memory, they don't get triggered anymore. And you can just live in the present rather than always having triggers pull you back to the past event. So I like to explain triggers as kind of time travel. They take us from a present moment experience to a past terrible experience where all of a sudden we're reliving the past terrible experience. We're not just in the moment of having a big heavy construction truck drive down the road. We're in the past, like we've traveled back in time to that bad thing, that big overwhelming traumatic thing that originally happened. Sometimes we're aware of what triggers us, like we might know, for example, a loud noise or a rumbling truck shaking the ground will trigger us. Sometimes we don't know and we're surprised all of a sudden to find that we're in a panic and we don't know why. But if you think back and kind of track back, just like when you track an animal and you look at the tracks they've left, you can track back what happened just before that moment of panic came over you, or that moment of anxiety, or when you all of a sudden start feeling yourself hyperventilating, breathing really hard, feeling lightheaded, feeling depressed, feeling like you're going to cry. Any of those symptoms, think back to what just happened that might have reminded you in some way, right, that past event. So you take a little piece of it and try and chew it up, digest it, put it through our system. Okay, I just started so hearing. So that it can eventually get put along memory and taken out. Once things are in long-term memory, they don't get triggered anymore. And so you just live in the present rather than having triggers pull you back to past events. So I like to explain
Judy, is that your YouTube?
Yeah, I don't know. I'm hearing my own voice coming back at me now.
Okay, it's
that's
okay.
Better.
It went up.
Okay, thanks. So let's see. So the process of a trauma is always an event that's overwhelming. It's always an event that overwhelms our brain's ability to process information. So it always comes with feelings of helplessness and powerlessness. So if you think about it, this is always a hallmark of trauma, is feelings of helplessness and powerlessness. Now I say this, it's very, very important, because whenever we think about healing from a trauma, we have to remember that anything following a trauma that makes us feel helpless and powerless all over again is going to feel like more trauma. So we balance that. Anything that helps us feel like we have a bit of control, some choice, some options, that is healing. So you can think of this in big ways and little ways. And again, when you're working with folks who've been impacted by trauma recently or far away, it's very important that you give them opportunities to feel like they're in control, that they're in charge of their own lives. Not that they're in control of anyone else, just over their own life. So even something so small as, would you like a glass of water? Would you like a glass of tea? You get to choose, you have some control. A little thing like that. Do you want to sit down? Do you want to sit down here or over here? Any little ways that we can offer the people we work with a sense of control, of regaining some of that control, it helps to heal from that helplessness and powerlessness that always comes hand in hand with trauma. So, for example, if you're trying to be helpful to someone who's been through a trauma, and you say to them, okay, you really should tell me about what's upsetting you. And they say, no, I really don't want to talk. No, it would really be good for you to talk about it. Not a good idea. Okay, first of all, it's a little disrespectful. But second of all, even in your attempt to help, you're making that person once again feel helpless. Okay? So we always want to be thinking about how to empower someone after a trauma, so that we start righting that imbalance of helplessness and powerlessness. It's more useful to say, I respect, it's your choice, you know yourself best. Okay, you know what's best for you. I want to support you in making the best decisions on how to take care of you. If you feel like it's not going to be helpful for you right now to talk, then good for you for taking good care of yourself. That's the most important thing. If you ever change your mind and decide you want to talk about it, I'm here to listen. I'm happy to listen. But I want to respect your choice, your decision. Okay, so I always want to be thinking about giving folks more sense of control and power. Also, because trauma is always something that is usually it's a surprise, right? It usually comes out of the blue. Not always, but usually, in this case, in the earthquakes. So again, we want to help balance that sense of being out of control with being predictable. And again, these are strategies for all of you as you take care of yourselves, but also you can use this with the people you work with. So as much as you can return to your own predictable life and routine and structure, that's really helpful. It helps our brains settle back down and lower the stress level. And once our brains are lowering the stress level, that helps our body calm down as well. So, you know, just the simple thing of getting back to routine as much as possible, or even predicting when there's going to be a change. So reminding people, just like we sometimes do with little children, we're going to leave in 15 minutes. We need to go over here, so prepare yourself for this change. Get ready, do whatever you need to do to get ready for this transition. Again, being respectful to the fact that trauma is usually unpredictable, and so to balance that, we want to really be predictable and warn people of what's coming ahead so that they can feel like, again, a little more sense of control and understanding of what's coming. Let's see. What I also want to remind all of you as relief workers is that research has proven without any doubt that hearing stories of other people's trauma, that seeing devastation that's affected other people, witnessing trauma, has just the same impact on us as being the victim of it ourselves. So we've learned this. There's been a lot of research around child abuse in the United States. A child who witnesses their mother being beaten by their father, for example, has exactly the same symptoms as if that child were beaten himself or herself. So we know that for humanitarian aid workers, for relief workers, for people who are helping on the front lines, whether you're a fireman or a rescue worker, or just someone who's a compassionate person, listening to the stories of other people's heartbreak and all that they've lost, that's going to have the exact same effect on you as if you had been through it yourself. So I'm saying this to really encourage you to treat yourself with the greatest care. And remember, the important question is always, how can I take good care of myself? Now, I know many of you are out there taking care of other people, so you feel like, well, I don't have time to take care of myself. But honestly, that's not an option. If you want to be in this for the long haul, you need to take care of yourself. Just like you charge up your iPhone or your computer, you need to do things to charge up your battery so that you can continue to do the work that is important to you, that touches your heart. So how do we take care of ourselves after we've heard all these stories and after we've been impacted ourselves and by hearing other people's trauma? So again, if this were a discussion, I would ask all of you, what are you already doing? You're all adults, so you already have strategies that you use to take good care of yourselves when your stress level gets too high and you need to bring it back down to a good place where it's manageable. Okay? Some of you got to see a handout that I sent out about what happens if we don't do this. This is when we start developing symptoms. Some of you may already have these. It's just a matter of your brain and your heart and your nervous system saying, whoa, too much, too much. I'm getting up into the red zone of stress where I can't manage it. So some of the things you may be noticing are, for example, one of the first things that gets impacted is our sleep patterns, right? Sometimes we find it really hard to fall asleep. You lie down to fall asleep, you close your eyes, you see the images from what you've seen all day of the destruction, you hear the stories, the voices, you picture what you've heard about over and over in your brain. Your brain's going 90 miles an hour, you can't slow it down. Or some people fall asleep right away, but they wake up in the middle of the night with all this stuff going through their brain. They can't slow it down, they can't fall back asleep. So that's one way that we notice that we're not taking good enough care of ourselves and we're starting to really take on too much of the trauma ourselves. Other people feel like crying all the time. Again, because your hearts are just getting so full to overflowing with what you're hearing, and it impacts us. Human beings are herd animals. We're very sensitive to the herd of people around us, just like horses are. So when we're around people who are feeling sad and overwhelmed all the time, it's contagious. We catch it. And I can guarantee you that the group of people who are listening to me, who have been doing this incredible work, helping out your own families and your own communities, that you're a particularly compassionate group of people. Now, being compassionate and empathetic is a wonderful quality, and it helps you make the world a better place and your community heal. But it also puts you at risk, because it means that your heart is particularly open and that you're a particularly caring person. So what this means is that it's very important to take especially good care of yourself as you go out with your open heart every day, caring about and taking care of those people around you. So again, I encourage you, some of the ways that we can take good care of ourselves, do that deep breathing so that you can help your own body calm down enough to get some sleep. I'm going to do another exercise in just a minute that I'll teach you. Make sure you're eating, okay? Sometimes we forget to eat, or we just grab something quick that doesn't really nourish our body. So make sure you're remembering to eat nourishing food that takes good care of yourself, okay? That's one way we take good care of ourselves, is to nourish ourselves, take some time to eat, even if it's 10 minutes, not in front of the computer, not in front of your phone. 10 minutes to have a calm, nourishing meal. Make sure you're drinking plenty of water, okay? Sometimes we forget about that, and our brains and our bodies don't work well unless we're completely hydrating ourselves and really drinking enough water. And then there's lots of other ways that we help bring our stress level down and take good care of yourselves. As I said before, I'm sure all of you as adults already know ways that work for you. So this is not a time to say, oh, I don't have time for that right now, because the stress will get too much of impact on you and you'll start coming down with some serious symptoms. So this is the time when we really need to dedicate ourselves to taking good care of ourselves, using those strategies that already work for you, for helping you get to a good place, for calming yourself, for getting to a place where you remember in your mind and in your heart that the world is a good place, okay? For some people that may be prayer, it may be listening to music, it may be exercise, going for a run or going to the gym, it may be preparing a nice meal to share with your friends that helps you feel good, it may be hanging out with your children, spending time with family. For some people it's dancing or singing. So I encourage you again to remember what works for you and dedicate yourself to doing some of those strategies, those self-care strategies every single day to take care of yourself, and so that you can continue to do the important work that you're dedicating yourselves to doing right now. We're getting to the end of the time. I want to make sure we have time for questions. So what I'd like to do right now is to just teach you again another little simple exercise. It's a little meditation. Some of you may already meditate. That's a wonderful, wonderful strategy for taking care of yourself. It calms our nervous system, it calms our brains, and it helps us gain a little bit of perspective. If you already have a meditation practice that you like and that works for you, great. If you don't, you can try this one, and if you like it, I encourage you to practice it every day. If you don't like it, you never have to do it again, right? So if you're comfortable, I'm going to teach a little meditation exercise right now. Excuse me. So I'd like everyone to again get nice and comfortable on your seats wherever you're sitting. Gently close your eyes. Take a few nice deep belly breaths and just calm your nervous system down. And I'm going to encourage you to clear your mind for a moment and just let yourself focus on your breathing. So bring all of your awareness just to the breath coming into your body, through your nose or through your mouth, and going out. Just breathe normally and bring all of your awareness, all of your attention, all of your brain, just to the act, the very natural act of breathing in and breathing out. And let your whole mind's eye just focus on your breath. And if your mind wanders off from focusing on your breath, which our minds always do, just very gently, without any criticism, without any judgment, bring your awareness back to your breath. Every single time you notice your awareness going off and thinking of something else, just very gently, just like you would a small child, with love and compassion, bring your awareness back to your breathing. And just let your breathing fill up your whole awareness. Now I invite you to repeat these phrases that I'm going to say. Say them to yourself in your mind over and over, slowly and gently, at whatever pace feels natural and comfortable to you. May I be strong. May I be healthy. May I be at peace. May I live with ease. May I be strong. May I be healthy. May I be at peace. May I live with ease. And now I ask you to just bring your hands up and put them gently over your heart. Feel the warmth of your skin against skin and that soothing feeling that we get when we place our hands over our heart. And remember to bring compassion and caring to ourselves, just as we do to all the people in our community who are helping. So with your hands over your heart, just repeat to yourself, may I be strong, may I be healthy, may I be at peace, may I live with ease. And I'm going to ask you to slowly open your eyes and return to this little chat webinar. Come back to the present moment. And again, I encourage you to use this. We just did this for a few minutes. I encourage you to do this a little bit longer every day. Give yourself some of your own precious compassion so that you can keep yourself healthy and in a good place while you go out and do all the work of bringing compassion and peace and healing to the people around you. So we're just about at the time now for questions. Thank you so much for giving me the opportunity to share some of my knowledge with you. And I thank you so much for all the work that you're doing to heal your communities and the world around you. So let's go to questions.
Great. Thank you so much, Judy, for that wonderful presentation. It was very, very useful, and I really hope it was useful for everyone. Yeah, let's, we have a couple of questions here already. I'll please feel free to post your questions on the comment box. I'll start with Supriya's question, Supriya Kasazu, and I think her question is relevant to many of us who are not in Nepal right now. So she's asking, for those of us who are not in Nepal at this very moment, how can we help reassure family members on the ground without having the advantage of being with them in person? And yeah, Judy, she has another question. In part two, her second question is, how can we effectively assist other family and friends who are undergoing vicarious trauma? They're not in Nepal, but are equally disturbed.
Those are great questions, and hopefully what I've shared with you, I hope will give you some of that answer. I'll just maybe reiterate some of what I said, because I'm really think it's important to remind your friends and family, no matter where they are, that they need to take good care of themselves first. So that always feels a little bit difficult at first, because it feels like we're being selfish or self-centered when we're also trying to be helpful. But really, you think of it, we have to keep ourselves in a good place so that we can help other people, right? So I always encourage people to think about what they need to take good care of themselves. So that's just a very simple question you can ask your family members who are far away. What do you need that will help you take good care of yourself? It's very simple, and already it's again in the line that I was talking about before, that healing comes from doing something where you have some control, right? So being helpless and powerless is more trauma. Having more control is healing. So I would steer you away from saying, oh, you should do this again, right? Because that's just making the person feel more helpless. That's more trauma. So I always like to ask the question, what can you do that will help you feel better? Now, if the person says, I don't know, I don't have any ideas, I like to give them a buffet of options, right? So again, you ask the question, what have you done in the past that works for you? If these are adults, they already know there are some things that they do in their normal life that helps them feel good, right? Helps them feel calm, helps them feel like the world is a good place. So ask people, what have you used in the past that helps you, right? Maybe, again, maybe it's prayer, maybe it's meditation, maybe it's sharing a meal with family members, maybe it's going for a walk with your best friend or with your dog, maybe it's digging in your garden, maybe it's, you know, making cookies. So ask the person, what do you do that helps you feel good? Maybe it's singing or dancing. So again, you would ask them what strategies they've used in the past and remind them now is the time where they really need to dedicate themselves to doing that. Even if it's 10 or 15 minutes a day, that will help. Okay. The other thing is, with vicarious trauma, it's important, again, to put some limits around it. So if someone is hearing stories all the time, they need to put some limits on it. Even professional psychologists and trauma specialists need to do that as well, right? So everybody has to start with taking good care of yourself. I know that sometimes the culture doesn't support that, and sometimes if you're working for an agency, they don't support that, but my word to you is, you are super important. Take good care of yourself. Encourage your family and your friends in Nepal to do the same thing. Okay? I hope that answered. Other questions?
Great. We have another question from Aki, and he's going to be working on the ground soon And so he's asking, and he's going to be involved in relief supplies distribution and rehabilitation efforts. And so he's really concerned about teenage kids who might have lost their parents and don't see much support in their lives. So I think he's asking, how can people who are actively working on the ground help kids, usually teens, who've lost their parents and don't see much support in their life?
Okay, great question. And teenagers are such a wonderful, amazing population and an amazing time of life. My favorite group of people are teenagers. So the thing with teenagers is, I mean, everything we talked about today applies, but there's some specific things that I think are helpful in working with teens. One is we always want to give people an opportunity to process what they're feeling. So I would always like to set up a time where if people choose, I would never ever force anyone, but if they choose to talk about what their feelings are, what they're thinking, what's in their heart, what are their fears, maybe they're feeling angry, whatever it is, to give folks an opportunity to have some conversation. So it's really, you don't have to be a psychologist to do this, it's just a matter of sharing. Part of it is it helps you to process an event by talking about it. The other thing is it also helps you feel normal when you hear other people have the same feelings and experiences, the same fears, the same doubts, the same sadness, depression, anger, whatever the feelings are. The same as you helps us feel normal. So just that being in a group where you have the opportunity to hear that your peers feel the same way you do and are going through the same thing is very healing in itself. Again, I would never force anyone to talk. So if someone wants to, I always tell in the beginning, if you want to pass, if you want to just listen, that's totally fine. The most important thing is to take care of yourself and to do what you feel is best for you. So if you feel it's best to share, great. If you feel it's best to just sit and listen and not say anything, then you really honor each teenager taking responsibility for their own healing. That's what we want. Now, teens are also very in the present moment, so we have to, I think, offer them ways to get back to normal teenage life. So you can have those opportunities for the processing, that's healing, but it's also very healing to return to their normal routine as much as possible. So if you can set up some school opportunities for them, some studying, get them back to what their normal life is, set up a soccer team, have them, do whatever they would normally be doing if their parents were still there, if they were still in their normal life. Return to that structure as much as possible. Distraction is a very, very healthy strategy for dealing with trauma. We don't want these kids, just like we don't want adults, to be sitting around feeling their feelings all day and not being able to get away from it. So give them some healthy ways to distract themselves, like soccer, like school. Give them tests, give them reading material, give them math homework. Have time for them to work on stuff right there. Give them whatever they would normally be doing. Try and return to that routine as much as possible, because you want to offer them normal, healthy distractions. If you can't help them distract from their upsetting feelings in healthy ways, they're going to find unhealthy ways to distract, right? And those are drugs, drinking, sexually acting out, all kinds of risky behavior. We don't want that. We want them to find ways to be able to focus on fun things, normal things, without doing any harm to themselves.
Great.
How's that?
Great. Yeah, we have a couple more questions. Beniv Maske, he has a few questions. So he's asking if there's a way to identify if someone's going through mental trauma. Are there physical signs? He's saying this might be useful to relief workers on ground. And his other question is managing mental trauma different during the relief phase, which is short-term, from the rehabilitation phase, which is long-term?
Yeah, great questions. So if you think of, you know, how trauma impacts people, there's a continuum. So most people will have, I mean, it's normal to have some ways that it impacts you, like trouble sleeping, feeling jumpy, nervous, feeling like crying, or else feeling numb is also very common, where you don't feel any feelings. These are all common symptoms, which normally will go away after a few weeks or a month. Okay, so those are all normal ways that we respond to a traumatic event. Most people will not develop long-term symptoms. But use your common sense, really. It's just common sense. When you see someone who seems like they're struggling or they're having symptoms that seem like, you know, when you say, whoa, this doesn't seem like it's normal to you, then I would, you know, then I would assume that they're having a larger problem. Maybe they've had previous trauma, or maybe, you know, they're just being impacted in a greater way. So some of the signs you might notice are, for example, some people stop talking. You might notice they've stopped being able to talk, right? Or they go completely numb and blank. That's another sign, you know, that maybe they're really struggling. Because one way we protect ourselves from all those upsetting feelings is just to try and shut them out completely, right? And some people are very good at doing that. It helps in the short term, but in the long term, that's not a useful strategy for dealing with trauma, because it doesn't help you ever process it through, right? It just keeps it frozen there. Some other symptoms, if people say they're not able to sleep at all, or they haven't eaten in days because they're just too upset. Again, those are things that are further along the continuum that I would start, you know, worrying maybe they need a little extra help or support. Now, I don't know on the ground there if you have any mental health professionals that you can refer people to if you notice that they're really struggling. If you do, great. Refer them to a mental health professional. If you don't, I would, again, start with those things I just taught you, the deep breathing, the little self-kindness meditation, and just some of the other things that we've talked about to help people feel like they're getting a little bit of a sense of control back over their lives. But again, normally we see a lot of very common symptoms right in the short term. Like I said, like the jumpiness, like the not ability to sleep, the crying or the going numb, the depression. Those are all very common in the short term, and for most people, those will dissipate and go back to normal within a few weeks or a month. The small percentage of people where that doesn't happen, where they don't get better over long term, those are the people who will need some help to be able to process that trauma so that they can fully heal. So that's, I think, the difference between the long-term and the short-term phase, is that over that course of time, most people will be able to heal on their own and with the support of their family or community. So we're just looking for those people who 2-3 months down the road from now are still really struggling. Those are people who could use some special mental health support.
Thank you, Judy. We have a short question from Lane, and the question is, how do you make people aware of trauma? Some are not aware of the effects of traumatic events.
Mm-hmm. Lane, I'm not sure if you're talking about the people you're working, like the organization you're working with, your coworkers, or if you're talking about the victims of the earthquake. So I'd say that if you're working with a humanitarian assistance organization or some other relief organization, hopefully they have some at least basic knowledge of trauma, although some are very sadly not very well educated. So you can just share the knowledge you have right now. You can go online. I think there's some stuff online. You can go to, here's a good website, childtrauma.com. There's some very good information on there, some papers and research articles about trauma, but there's other websites as well on trauma. So you can look online and find some information to educate yourself and then to share with your coworkers. If you're talking about just regular normal people who you're helping who wouldn't necessarily have information about trauma, I would say just share exactly what you've learned. Put it into very everyday language so that anyone can understand it, and share what you've learned. Again, when we normalize how people have been impacted and how people are responding, I think that's one of the first and most important ways that we help people heal, is by letting them know that their reactions and what they're now experiencing is a completely normal human reaction to an abnormal event. So it was the event that was unusual and abnormal, but that their reactions and what they're experiencing is completely normal within the range of human behavior. So just in normalizing that, letting people know that they're not going crazy, I think it's very healing in itself. And that, again, for most people, these symptoms will subside over time to bring some patience and some compassion to themselves as they go through this healing process. It's a process, and it takes some time. So again, bringing some of those 2 exercises that we learned, that self-compassion, just for people to really be patient with themselves, be patient with their loved ones, their families, their children, their elderlies, and to really try and access some compassion and patience with other people and with themselves for whatever they're going through as they go through it.
So Judy Lane just commented and is talking about victims. Some don't know what trauma is.
Mm-hmm. Yeah, I would again just really explain, that it's a big, terrible event, and it's so big and horrible that our brain can't make sense out of it. I mean, that's really what trauma is. It overpowers our brain's ability to make sense out of it and to process it. And I always like to tell people that trauma is always an event that overwhelms us, so we always end up feeling helpless and powerless. Those are, again, normal reactions to an abnormal event. So again, to just normalize that these are feelings that they'll have for a little while, helplessness, powerlessness, fear, that hyperarousal, that jumpiness, maybe crying, maybe feeling numb, maybe feeling depressed, maybe feeling hopeless, right? These are all very normal reactions. So I always think of saying, who wouldn't feel this way, having gone through what you've just gone through? So this is very normal. It's, just, again, really bringing some patience and compassion to what horrible thing you've just lived through, and the way that as human beings we react and we heal. It takes some time. Just like if you break your leg, if you have a physical injury, it takes time to heal. And during that healing process, it hurts. It feels bad. We can't do what we normally could do. It's exactly the same with psychological trauma. It hurts. We can't do what we used to be able to do as we're going through the healing, but most people will be able to heal and get back to where they were before. And if in a few months they find that that's not the case, then they should really seek out some professional help. Again, I don't know what's available for different communities, but if they've made contact with a relief organization, usually they should be able to access some mental health, or they call it psychosocial support. But again, just like when you have a physical injury, it's the same thing. Your body knows what it needs to do to heal, for the most part, and you have to be patient with it. You have to be gentle with that injury as your body heals. It takes time. You have to eat well. You have to sleep well to help your body heal. It's the same with psychological healing.
Thank you, Judy.
We really need to maybe take one more question and then...
Yeah. Yeah, we actually have one last question left.
Thanks.
We've covered all the questions. We have a question from Akita Joshi, and she's actually talking about how hyperarousals that you mentioned. And
Mhm.
so she says, you mentioned hyperarousals that takes you back to a traumatic event, and that we need to find the triggers for those hyperarousals and find control over them. But the aftershocks that has been reoccurring in Nepal are causing renewal of those fears, anxiety, and shock, and are really very unpredictable.
Mhm.
So she's saying, I really appreciate the exercise you demonstrated, but are there other ways to get them ready for calm and ready for those aftershocks?
Mhm. Yeah, that's a really good question, and it's such a difficult situation because really, it's like those aftershocks are, the way I think of it is like, all right, the earthquake already knocked you down, and now these aftershocks are just, it's like we have a saying, you don't kick someone who's down, right? But that's what these aftershocks are doing, is really hurting someone who's already hurt and just hurting them more and more and more. So it's absolutely causing more and more and more trauma. And, you kind of wonder, well, how much can a person tolerate? So I think those are really good concerns, because the way we heal from trauma is through, this recovery process. But if the traumas keep happening, it's very hard to get to the recovery process. So that's a really good question. And I don't feel like I have any brilliant answer for it, except that, we just take little baby steps in the direction we're trying to go in. So if you do some meditation, if you do some deep breathing every day, you will be moving in the direction of healing. And when the aftershocks happen, yes, they're going to be more trauma, but if you're taking good care of yourself, you'll be in a better place to recover than if you weren't. So really, that's all I can say, is I think of it as taking steps along a path in the direction you want to move in. Unfortunately, I don't know of any way to take giant leaps down that path. I wish I could offer you that, because really the first step in healing from trauma is being in a place of safety. But obviously you can't just magically make the aftershock stop, and you can't magically move people to a place of safety. So all you can do is really help people move in the good direction of healing and calming, and know that these are setbacks that are, we have no control over those, unfortunately. So again, asking people whatever helps them to get a sense of perspective, to get a sense of calm, to get a sense of having encouragement or optimism in the world. It's very hard given the situation with all these aftershocks. But even if you can get a little tiny piece of that, I would hold on to it like it's gold, it's precious. Just having a moment where you sit quietly with your family or loved ones, and just think of a few things that you can be grateful for, so that we focus our mind on the few little places where things are going well. Even something like, today the sunshine came out, and I know the monsoons are coming, so that's adding even another layer of trauma for people living in tents or out on the street. But whatever it might be, today I got to eat breakfast. Today I had a delicious meal. Today I got to drink some clean, cold water. Today I got to hug my daughter or my son. Little places where you can remind and encourage people to have a little bit of optimism and hope. Again, those are just taking steps in a good direction that we want people to go in.
Great. Thank you so much, Judy. And thank you, everyone, for joining us today. Just want to request everyone to share these strategies that Judy mentioned and the exercises with your friends, your family, and your community. Yeah, and Judy, do you have any last words to say?
Just thank you, thank you, thank you for all of the hard work you're doing. Please take good care of yourself. And as I discussed with Kusum, I'm going to be unavailable for a few weeks, but when I come back, I'm happy to do a follow-up if people have more questions or feel like there's other areas that might be helpful to go into a little bit more. I'd be honored to be able to help in that way. So I appreciate your giving me this opportunity. I hope it's been helpful. And please take care of yourselves. Thank you so much for all the hard work you're doing. And have a good rest of your day.
Thank you so much, Judy. Thank you so much. And feel free to continue the discussion on the comment section. Thanks.
Okay. Bye-bye.
Bye.